Want to keep your penis in shape? Then this video is for you. My name is Dr. Eva Hart, and I specialize in urology, with 14 years dedicated to men's health concerns. Today I will reveal 9 critical things you must never do to your penis. Gentlemen, treating penises is my profession, and I genuinely care about penile wellness. You should care too. This video contains 9 essential mistakes you must avoid to protect your penile health, information most men never learn. Make certain you watch until mistake number 9 because it will absolutely shock you. Before diving in, let me request something important. Those who have watched my content and found value, please subscribe to this channel. Current subscribers should activate notifications. I produce educational material constantly, and missing these insights means losing valuable health knowledge. Statistics show most viewers remain unsubscribed. Please help me by subscribing and sharing this channel with men who need this information. Spreading crucial health education truly makes a difference. First, practice gentle self-stimulation techniques. Extremely aggressive self-stimulation using excessive force or rapid motion conditions your body for unrealistic stimulation intensities impossible to duplicate with partners. This creates substantial partnered intimacy difficulties that affect thousands of men over 60. Your nervous system develops and anticipates particular response patterns through repetitive conditioning. Consistent excessive pressure use causes bodily adaptation requiring progressively stronger stimulation for satisfactory outcomes. This neurological conditioning process can take months or years to develop, but once established becomes increasingly difficult to reverse. The medical explanation involves nerve pathway conditioning. When you repeatedly expose nerve endings to intense pressure or aggressive techniques, they become less sensitive to normal stimulation levels. Your brain adapts by requiring stronger signals to register pleasure and achieve climax. Many men develop these patterns without realizing the long-term consequences. What begins as occasional aggressive techniques gradually becomes the only method that produces results. Over time, partnered intimacy becomes frustrating because no partner can replicate the intensity levels your body now requires. The psychological impact extends beyond physical function. Men experiencing these difficulties often develop performance anxiety, relationship stress, and decreased confidence. They may begin avoiding partnered encounters entirely, leading to relationship problems and emotional isolation. Apply lighter touch, slower rhythms, and quality lubrication during self-stimulation. Emphasize pleasure and diverse sensations over rapid climax achievement. Train your nervous system responding to gentler, achievable stimulation patterns that mirror realistic partnered experiences. This reconditioning demands patience and consistency, yet men implementing these changes report significantly enhanced partnered intimacy and increased overall satisfaction. The process may take several weeks or months, but the improvement in relationship quality makes the effort worthwhile. Second, protect your testicles from excessive heat. Testicles hang externally because they require temperatures 2 to 3 degrees lower than core body temperature for optimal sperm and testosterone production. Regular heat exposure can severely compromise these vital functions, leading to decreased hormone levels and diminished masculine vitality. The science involves cellular function optimization. Sperm production and testosterone synthesis occur through complex biochemical processes that function best within specific temperature ranges. When testicles experience elevated temperatures for extended periods, these processes become less efficient, affecting hormone production and reproductive health. Modern lifestyle habits create numerous sources of testicular overheating. Extended laptop use with the device resting directly on your lap transfers significant heat. Smartphones carried in front pockets emit heat throughout the day. Tight-fitting clothing restricts air circulation, trapping body heat around the testicles. Professional drivers, office workers who sit for long periods, and men who work in hot environments face particular risks. The combination of prolonged sitting, restricted air circulation, and environmental heat can create consistently elevated testicular temperatures that gradually damage hormone production capabilities. Research demonstrates that even moderate temperature increases, sustained over weeks or months, can significantly reduce testosterone levels and affect overall vitality. Men experiencing unexplained fatigue, decreased sex drive, or mood changes should consider whether excessive heat exposure might be contributing to their symptoms. Minimize extended time in hot tubs, steam baths, saunas, and lengthy hot showers. Prevent laptop placement directly on your lap. Use a desk or lap desk with insulation. Store phones in rear pockets instead of front pockets. Choose loose-fitting undergarments promoting air movement around the testicles. Your testicles function constantly producing hormones maintaining masculine energy and general vitality. Heat protection represents straightforward support for optimal function throughout aging, requiring only simple awareness and minor lifestyle adjustments. Third, stop dismissing your natural health monitor. How your penis performs acts like your body's personal health dashboard, providing early warning signals about cardiovascular health, hormonal balance, and overall physical condition. Research tracking men experiencing initial erection troubles reveals that roughly 14% develop cardiac issues within 7 years following their first symptoms. Medical professionals refer to erectile problems as your body's early alert system because the penis requires optimal function of multiple body systems simultaneously. Strong, reliable function combined with healthy sexual appetite signals multiple positive health indicators working in harmony. Your circulation system must operate effectively to deliver adequate blood flow to penile tissues. Hormone levels need proper balance to maintain desire and support physiological processes of arousal. Neural pathways must function correctly to transmit signals between the brain and genital area. Penis contains some of the smallest blood vessels in the male body, making them among the first to show signs of cardiovascular problems. When these tiny vessels begin showing damage from high blood pressure, diabetes, or other circulatory issues, erectile function suffers before symptoms appear in other body systems. Hormonal changes affecting testosterone, thyroid function, or other endocrine systems often manifest first through changes in sexual desire or performance. Neurological conditions affecting nerve transmission frequently show early signs through altered genital sensation or response patterns. Penis performance directly reflects cardiovascular condition, hormonal balance, stress levels, and overall physical vitality. Declining function represents your body broadcasting urgent health warnings about emerging medical concerns that may require professional evaluation. The answer remains simple. Monitor changes carefully and take them seriously. Track shifts in morning rigidity, sensitivity variations, or performance alterations over time. These symptoms constitute health alerts that could preserve your life when heeded appropriately. Understanding this connection empowers you to address root causes rather than just symptoms, potentially preventing serious health conditions through early intervention and lifestyle modifications. Fourth, eliminate smoking and embrace healthy lifestyle. Smoking systematically destroys erectile function through multiple biological pathways while accelerating overall health decline. Tobacco directly harms blood vessels throughout your body, including the microscopic vessels supplying penile tissue essential for normal function. The vascular damage from smoking begins almost immediately and continues accumulating over years. Chemicals in tobacco smoke damage the inner lining of blood vessels, making them less flexible and reducing their ability to dilate properly during arousal. This affects the penis first because it contains the smallest blood vessels in the male body. Smoking reduces blood oxygen content by replacing oxygen molecules with carbon monoxide, meaning even reduced blood flow carries less oxygen to tissues requiring it for proper function. Nicotine acts as a vasoconstrictor, causing blood vessels to narrow and restricting blood flow even more. Broader lifestyle factors prove equally crucial for intimate health maintenance. Poor food choices lacking essential nutrients fail to provide building blocks necessary for healthy blood vessel function and hormone production. Heavy alcohol use damages liver function, affecting hormone metabolism and contributing to circulatory problems. Exercise avoidance leads to poor cardiovascular fitness, reduced blood flow, and decreased testosterone production. Physical activity stimulates blood circulation, supports hormone balance, and helps maintain healthy body weight, all factors directly affecting intimate function. Persistent stress elevates cortisol levels, which interfere with testosterone production and contribute to blood vessel damage. Chronic stress also affects sleep quality, further disrupting hormone production and recovery processes. Consume nutrient-dense foods supporting circulation and hormone manufacturing, particularly foods rich in antioxidants, healthy fats, and essential minerals. Control stress through relaxation methods, sufficient sleep, and purposeful activities that bring satisfaction and peace. Your body demonstrates extraordinary healing abilities when provided optimal conditions. Men adopting healthier lifestyles report enhanced energy, improved mood, and restored intimate function regardless of age, often seeing improvements within weeks of making positive changes. Fifth, avoid hazardous home enhancement attempts. My clinical experience includes encountering every conceivable dangerous scenario, and I must state clearly, no safe household remedy exists to enlarge your penis, increase thickness, or boost performance. No miracle concoction will create overnight transformation, despite what internet marketing promises desperate men. The desperation surrounding male enhancement concerns creates a vulnerable population willing to try increasingly dangerous methods. Men become eager to pursue any potential solution for their challenges, whether involving size insecurities or performance difficulties, often without considering safety risks. Most enhancement methods lack scientific validation, pose significant safety risks, and potentially cause permanent harm that cannot be reversed through medical intervention. The damage from these attempts often creates worse problems than the original concerns. Consider these dangerous examples encountered in emergency medicine. Jelqing requires applying sustained hand pressure and aggressive stretching motions supposedly to gain length over time. This technique proves problematic by creating microscopic tissue tears throughout penile structures, producing cumulative injuries that eventually trigger erectile dysfunction. Penile tissues contain delicate blood vessels, nerve endings, and specialized erectile tissue that cannot withstand repeated trauma. Each jelqing session creates tiny amounts of damage that accumulate over weeks or months, eventually causing scar tissue formation that interferes with normal blood flow and nerve function. Every urologist has treated young men who practiced excessive jelqing techniques learned from internet videos and suffered permanent damage requiring surgical intervention. Some cases involve complete loss of erectile function in men who previously had normal performance. Additional risky behavior includes fashioning homemade constriction devices from household materials. Cases involve men using construction hardware, plastic bottle rings, or rubber bands requiring emergency removal procedures performed by fire departments or surgical teams. Tissue damage from these emergency situations can prove severe and lasting, often worse than any original problem the man was trying to address. Emergency removal procedures may require cutting through metal or plastic very close to delicate tissues. Remember this principle. Miraculous enhancement claims usually indicate deception designed to exploit male insecurities. Support your body's natural healing mechanisms instead of fighting against them through dangerous experimentation. Sixth, address pain and abnormal signs immediately. Any penile problems require immediate medical consultation without delay. Never dismiss worrying symptoms, hoping they will resolve independently. These symptoms might indicate sexually transmitted diseases, urinary infections, kidney problems, or severe conditions requiring prompt treatment to prevent permanent damage. Urinary blood could suggest kidney stones causing internal bleeding, bladder complications including infections or malignancy, or prostate problems affecting normal urination. Even small amounts of blood require professional evaluation to determine the underlying cause and appropriate treatment. Strange lumps, unusual growths, persistent sores, or changes in skin color might represent various conditions ranging from minor infections to malignancy requiring immediate intervention. Though penile cancer occurs rarely, quick medical intervention dramatically improves treatment success rates and preserves maximum function. Pain during urination, unusual discharge, persistent itching, or burning sensations often indicate infections that can spread to other organs if left untreated. Sexually transmitted infections can cause permanent scarring and damage if not addressed promptly with appropriate medications. Sudden onset of severe pain, especially accompanied by swelling or color changes, may indicate serious conditions like penile fracture, blood clot formation, or other emergency situations requiring immediate surgical intervention to preserve function. Understanding the natural difficulty of exposing intimate areas to healthcare providers is completely normal, yet endangering your health over temporary discomfort proves extremely unwise. Should one physician make you feel judged, find another provider who demonstrates appropriate professionalism. Never ignore concerning symptoms due to embarrassment, fear of medical costs, or hope that problems will disappear without treatment. Early medical intervention typically requires less invasive treatments with better outcomes compared to advanced conditions. My most devastating cases involve men who dismissed clear warning signs until they became life-threatening emergencies requiring extensive surgical procedures and often permanent functional limitations that could have been prevented through early treatment. Healthcare professionals maintain absolute confidentiality and clinical objectivity. We received extensive training specifically to handle sensitive medical issues with professionalism, compassion, and respect for patient dignity. 7th, maintain cleanliness without causing damage. Everyone recognizes the necessity of penile cleanliness for health and social reasons, yet significant problems develop when men employ overly aggressive cleaning techniques or, for uncircumcised men, neglect proper foreskin hygiene. Uncircumcised men must carefully retract foreskin during daily hygiene routines, cleanse underneath gently with warm water, and ensure thorough drying before replacing the foreskin. This routine prevents bacterial buildup, reduces infection risks, and allows visual inspection for abnormal changes. The area beneath the foreskin naturally accumulates dead skin cells, body oils, and other materials that can harbor harmful bacteria if not removed regularly. However, this delicate tissue requires gentle handling to avoid injury or irritation. Inability to retract foreskin comfortably indicates a condition called phimosis that requires medical consultation. Sometimes this can be resolved through gentle stretching exercises or topical treatments, but professional guidance is essential. Simultaneously, avoid harsh soap usage, aggressive scrubbing, and frequent washing that disrupts natural protective mechanisms. Penile skin remains more delicate than other body areas while maintaining natural protective barriers including beneficial bacteria that help prevent harmful organism growth. Powerful antibacterial cleansers eliminate both harmful and helpful bacteria, leaving the area vulnerable to infection by resistant organisms. The natural skin pH and bacterial balance take time to restore after disruption. Rough washing techniques can cause microscopic tears in delicate skin, providing entry points for bacteria while causing irritation, inflammation, and discomfort that may persist for days. Employ mild, unscented soap with comfortably warm water during regular shower routines. Cleanse softly without aggressive friction, excessive pressure, or repeated scrubbing motions. Prevent overwashing habits that strip away natural protective oils. Your body evolved sophisticated cleanliness maintenance systems over millions of years, assist these natural mechanisms rather than disrupting them through overly aggressive intervention. 8th, practice safe intimacy with proper control. Nothing surpasses the importance of secure, controlled intimate encounters for maintaining long-term sexual health and preventing injuries that can permanently damage function. When infection concerns and injury risks disappear through proper precautions, you can remain completely present and thoroughly enjoy intimate experiences. Always emphasize safety through appropriate protective measures including barrier methods that prevent sexually transmitted infection transmission. Even in monogamous relationships, maintaining awareness of hygiene helps prevent bacterial transmission that can cause uncomfortable infections. Additionally, maintain situational awareness and control during intimate moments to prevent severe trauma like penile fractures that constitute true medical emergencies. Vigorous activity causing penile slippage and impact against hard surfaces while erect can tear delicate internal structures. Penile fractures occur when the tunica albuginea, the tough outer covering of the erectile cylinders, tears due to excessive bending force. This injury typically happens during vigorous intercourse when the penis slips out and strikes the partner's pubic bone. Such injuries typically produce audible popping sounds, immediate intense pain, and rapid tissue swelling. Emergency medical treatment and surgical repair become mandatory within hours to prevent permanent erectile dysfunction and other complications. Even with perfect surgical repair performed immediately, penile fractures can result in permanent curvature, reduced rigidity, ongoing pain, or complete loss of erectile function. Prevention through awareness and control remains far superior to treatment after injury. Prevention involves maintaining positional awareness during intimate activity, moderating intensity and rhythm to maintain control, and ensuring sufficient lubrication to reduce friction that contributes to slippage and impact injuries. Aging naturally reduces women's lubrication production significantly due to hormonal changes. This represents completely normal physiology unrelated to attraction levels or relationship satisfaction. Quality personal lubricants enhance safety and comfort for both partners while reducing injury risks. 9th, practice mental self-compassion. Men experiencing penile difficulties become excessively self-critical, creating psychological patterns that often prove more destructive than original physical problems. They obsess over performance details, fear partner judgment, and generate intimacy anxiety, making everything worse through stress-induced dysfunction. This destructive mental sequence unfolds predictably. One imperfect performance episode occurs due to fatigue, stress, medication effects, or other temporary factors. During subsequent intimate attempts, you fixate on that previous experience continuously, analyzing every sensation instead of enjoying the moment. This performance monitoring creates anxiety that interferes with the natural physiological processes of arousal and function. Your nervous system cannot maintain the relaxed state necessary for normal sexual response while simultaneously analyzing performance in real time. The anxiety makes normal function increasingly difficult, creating exactly the problems you fear most. This generates escalating worry patterns where each subsequent difficulty reinforces fears about permanent dysfunction. The psychological impact extends beyond sexual function into general mood, self-esteem, and relationship satisfaction. Men caught in this cycle often become withdrawn, irritable, and depressed, avoiding intimate encounters to prevent potential failure. Everyone encounters occasional intimate function variations throughout life due to fatigue, stress, health changes, medications, or relationship factors. Temporary challenges never indicate permanent dysfunction. They represent normal human experience that resolves naturally when not amplified by anxiety. Exercise self-kindness and realistic expectations rather than perfectionist standards that create unnecessary pressure. Prevent anxiety spirals following occasional setbacks by maintaining perspective about normal function variations. Maintain open partner communication about concerns rather than suffering in silence. Most intimacy relationship problems stem from mistaken assumptions and lack of communication rather than genuine physical limitations. Concentrate on emotional connection, physical pleasure, and intimate bonding instead of performance monitoring. Removing performance pressure frequently allows natural function restoration while improving overall relationship satisfaction. This strategy focuses on optimizing your current health rather than attempting to recapture youth. Your masculine vitality can be maintained when you understand proper body support methods. If this information proved helpful, comment about what resonated most with your situation. Taking care of yourself matters because you deserve the best possible quality of life.